Come in.
Okay, I'm performing hand hygiene and closing the door for privacy. Hi, Mr. Rogers. My name's Evelyn. I'm going to be your nurse today.
Hello.
Can I verify your name, last name, and date of birth, please?
Carl Rogers, 315.
Okay, MR number is 77-18854. 77-18854. Do you have any allergies, Mr. Rogers?
No, I do not.
Okay, and patient does not have an allergy band. Okay, so today I'm going to complete a head-to-toe assessment on you, okay?
Okay.
I'm going to start off with the vital signs. So my temperature, I have an oral temperature of 98.4. Blood pressure is 125/78. Heart rate is 85. Respirations are 20, and I'm going to assess that for 1 minute. Okay, 20 for respirations. Patient, his O2 is 97% on room air. Are you in any pain?
Yes, I am.
Okay, what's your pain level at from 0 to 10?
It's about a 3.
About a 3. Okay, is it a sharp pain, a dull pain?
It's a sharp pain.
Does it radiate?
It does not radiate.
Okay, and what makes it better?
Pain meds make it better.
Okay, and what's making it worse?
When I touch it.
Okay. All right, so we'll see if we can get you something for that pain. Where's that pain located?
It's on my right heel.
Your right heel. Okay. All right. So, do you know where you are?
I am. I'm at Fortis Hospital.
Okay, and why are you here?
I got a right heel ulcer and I can't get my diabetes under control.
You can't get your diabetes. Okay, so what's today's date?
July 29th.
Okay, patient is alert and oriented ×4. And again, I'll perform hand hygiene. All right, Mr. Rogers. I'm gonna go ahead and check your blood sugar, okay?
Okay.
Do you have a preference in which finger I poke?
It doesn't matter.
Okay. Okay, so I'm getting an alcohol swab. I'm going to swab the finger that I'm going to be poking. And then I'll get the little lancet. I'll poke the side of it. And I have blood right there. So I'll go ahead and put the test strip on it. Okay, so blood sugar level is at 123. And I'll wipe that off and put a Band-Aid on it. And I'm going to go ahead and remove my gloves and perform hand hygiene. All right, so patient's blood sugar is a 123. Okay, so let's start by asking, have you been coughing?
I have been coughing. Yes.
Okay, is it a productive cough?
It is productive.
Okay, what's the consistency?
It's thinner.
Okay, what would you say the amount is?
It's about 5 milliliters.
All right, perfect. Okay, so I'll go ahead and document that. And what about color? Is it white? Is it yellow?
It's like a white, frothy-ish color.
Okay. All right, so let's go ahead and check your pupils. Okay, so I'm checking your pupils. Okay, and then if you can follow my pin light just with your eyes. Okay, pupils were a 4 and pupils are equal round reactant to light and accommodation. I'm going to check your mucous membranes. Will you please say out for me? Okay, so mucous membranes are pink, moist, and intact. I'm just going to put some gloves on, so I'm performing hand hygiene. And let me get those gloves on. Okay, and I'm going to assess skin turgor. So I'm going to pinch the skin and I don't see any tenting of the skin. Okay, so I am inspecting the arms. I'm moving down to the arms. I'm going to inspect the arms. They are dry, warm, intact. And there's no lesions, no bruising, no sores. I'm going to inspect the IV site. It is dated for today. I don't see any redness, swelling, infiltration. I will flush it when I give medications. the dressing is intact. Okay, do you feel any pain when I touch around your IV site?
Oh, no.
No? Okay. Alright, so next I'm going to check brachial pulses. So brachial pulses are 2+ bilaterally, and then radial pulses are also 2+ bilaterally. Okay, I'm going to check capillary refill on both sides, and they are less than 3 seconds bilaterally. I'm assessing the upper extremities for any cyanosis, and I don't see any cyanosis. And now I'm going to check your strength, okay?
Okay.
So can you go ahead and grip my fingers? Okay, and that's +5, and push up against my hands. Okay, and then push on my hand. Okay, so +5 for both, and that's bilaterally. Okay, so now I'm going to go ahead and inspect your chest. I'm inspecting the chest for symmetry. Chest appears to be symmetrical. There are no lesions, no bruising, no abnormalities. Okay, and then I'm going to go ahead and listen to your heart sounds, okay?
Okay.
Okay, so second intercostal space on the right is the aortic valve. Second intercostal space on the left is a pulmonic. Erb's point is third intercostal space on the left. Tricuspid is fourth intercostal space on the left. And fifth intercostal space on the left midclavicular line is the mitral. And I'm going to assess your apical pulse for 1 full minute. Okay, and 1 full minute has passed, and the apical pulse rate is 84. Okay, and now I'm going to go ahead and listen to your lung sounds. I'm going to listen to 8 points in the front and 10 points in the back. S1, S2 were heard throughout, no murmurs for the heart sounds, and nor abnormalities heard. Okay, so I am going to listen to your lung sounds. Okay, so the lungs are clear to auscultation bilaterally, anteriorly, and posteriorly. Okay, and now I'm going to inspect the abdomen. Respirations, I did mention, were 20, and regular rate, regular rhythm, and depth as well. Patient doesn't appear to be in any distress. Okay, so I'm going to inspect the abdomen, and I'm inspecting for abdominal distension. There is no abdominal distension that I can see. There is no bruising, no lesions, or any abnormalities that are visible in the abdomen. Okay, so I'm going to go ahead and just listen to your bowel sounds, okay?
Okay.
Okay, I'm going to start with the right lower quadrant. And we have active bowel sounds, right upper quadrant, active bowel sounds, left upper quadrant, active bowel sounds, and left lower quadrant, active bowel sounds. So active bowel sounds in all 4 quadrants. All right, Mr. Rogers, next I'm going to go ahead and palpate your abdomen, and you're going to let me know if you feel any pain or tenderness, okay?
Okay.
So what I'm inspecting or palpating for is basically any pain, tenderness, or if I feel any masses. So right lower quadrant, any pain or tenderness?
No.
Okay, and I don't feel any masses. Right upper quadrant, any pain or tenderness?
No.
Okay, no masses. Left upper quadrant, any pain or tenderness?
No.
Okay, and no masses. And left lower quadrant, any pain or tenderness?
No.
Okay, and no masses palpated. So there was no pain, no tenderness, and no masses felt upon palpation on all 4 quadrants. Okay, so next I'm going to go ahead and inspect the genitalia. First, actually, let me ask you, when was your last bowel movement?
It was last night.
Last night? Okay, and what was the color?
It was brownish color.
Okay, any unusual odor?
No.
Okay, what about consistency? Was it formed? Was it soft?
It was soft.
Okay. And amount, was it a large amount, small, medium?
It was a medium amount.
Okay, great. And when was the last time you voided?
This morning.
Okay. What was the color?
It was a straw color.
Okay, was it cloudy? Was it clear?
Yeah, it was a clear color.
Okay, what would you say the amount was?
About half a urinal.
Okay, any odor to it?
No, no odor.
Okay. Alright, so I'm inspecting the genitalia. I'm inspecting the genitalia. I don't see any redness, any swelling. So no redness, no swelling, no drainage, and no lesions or any sores or anything. Okay. Have you had any pain when you void?
No pain.
Okay. Any urgency?
No, none of that.
Okay. What about frequency?
No change in frequency.
Okay, so I'm performing hand hygiene. Okay, and right now I'm just inspecting the legs, and the legs appear warm. Dry, I don't see any bruising, any lesions. Okay. And I'm also going to assess the skin for edema. So it is warm to touch. There is no edema. Okay, do you feel any tenderness in your legs?
No.
No, okay, I don't see any cyanosis in the legs either. Alright, so I'm gonna go ahead and just feel on your tibial pulses, okay?
Okay.
Okay, and that's +2 bilaterally. And then I'm going to check dorsalis pedis, and that is also +2 bilaterally. Okay, and now I'm gonna assess your strength, so I just need you to push up on my hands.
Okay.
Okay, and then push down on my hands. Okay, so that's +5 bilaterally. Sorry, so it's +5 on the left side and +4 on the right side. Okay, now I'm gonna go ahead and check cap refill. And I'm assessing cap refill and less than 3 seconds bilaterally. So I'm gonna go ahead and just take a look at your dressing, okay?
Okay.
Okay, so the dressing appears to be intact. I do see scant serosanguinous drainage. So we will be changing your dressing later on, okay?
Okay.
Alright, and then I'm all done with the head to toe. I'm going to assess your vital signs, and we're gonna check your pain again, okay?
Okay.
So I'm removing my gloves, and I'm performing hand hygiene. Okay. Alright, so oral temperature is 98.2, heart rate is 82, O2 is 97% on room air. Blood pressure is 122/76, and respirations I will assess for 1 full minute. And respirations are 18. I'm gonna go ahead and check your blood sugar again, okay?
Okay.
Alright, so again, I'm gonna perform hand hygiene. Get my gloves on. Okay, so I'm going to do you have a preference in where I poke again?
No, it doesn't matter.
Okay, so I'll pick a different finger this time. I'm gonna go ahead and swab it with a little alcohol swab. Okay, I'm gonna get the lancet and just go ahead and prick the side of the finger. to squeeze a little bit and let the test strip get the blood. Okay, blood sugar level is reading at 123. And I'm going to go ahead and place a Band-Aid on it. And I'm removing my gloves and again performing hand hygiene. All right, Mr. Rogers, last question for you. Your pain. Are you in any pain?
A little bit.
A little bit? Okay. On a scale from 0 to 10, 0 being no pain at all, 10 being the worst pain, what would you rate your pain at?
About 1 out of 10.
1 out of 10, okay. Is it radiating?
It's not radiating.
Okay, and is it a sharp pain or a dull pain?
It's not as sharp as before.
Okay. What's making it better?
The medicine definitely helped.
Okay, great. So the Tylenol's working. What's making it worse?
Touching it.
Okay. All right, Mr. Rogers, do you have any more questions for me today?
No, that's it.
No? All right. Well, your call light is in place. The patient's needs have been met. I'm going to go ahead and put the bed rails up. The bed is in the lowest position. I'm going to wash my hands and close the door for privacy.